Here's a detailed overview of Fenoldopam. Generic name, Fenoldopam. Drug class, dopamine agonist, selective dopamine 1 receptor agonist, antihypertensive agent, Corlopam. What is Fenoldopam? Fenoldopam is a fast-acting vasodilator that works by relaxing blood vessels and increasing blood flow, leading to a rapid reduction in blood pressure. It is primarily used in hospital settings for acute management of severe hypertension. Indications, uses. Fenoldopam is used for severe hypertensive crisis, short-term, up to 48 hours, intravenous treatment for critically high blood pressure. Postoperative hypertension, used after surgery to manage acute increases in blood pressure. Contraindications. Fenoldopam should not be used in patients with known hypersensitivity to fenoldopam or its components. Glaucoma, it increases intraocular pressure. Hypokalemia, low potassium levels. Fenoldopam may worsen electrolyte imbalances. Vital information. Fast-acting, works within minutes, requiring careful monitoring. Can cause reflex tachycardia, rapid heartbeat, caution in patients with heart conditions. May lower potassium, hypokalemia, monitor electrolyte levels, can increase intraocular pressure, avoid in patients with glaucoma. Before taking this medicine, precautions. Before using Fenoldopam, inform your doctor if you have heart disease, especially recent heart attack, angina, or arrhythmias, kidney disease, glaucoma or intraocular hypertension, electrolyte imbalances, low potassium, low sodium, etc. Fenoldopam is given intravenously IV in a hospital, so your doctor will closely monitor your response. How to use Fenoldopam, given as an IV infusion, intravenous drip, in a hospital setting. Dosage is carefully adjusted based on blood pressure response. Continuous monitoring is required to ensure safe administration. Dosing information. Initial dose, 0.1 milligram Coumadin IV infusion. Titration, increase by 0.5 to 0.1 milligrams per kilogram per min every 15 minutes as needed. Maximum dose, 1.6 milligrams per kilogram per min. Duration, used for no more than 48 hours. Special considerations, elderly patients may require lower doses due to increased sensitivity. Pediatric use, limited data but may be used cautiously under medical supervision. Missed dose, since Fenoldopam is given only in a hospital setting, missing a dose is not common. If stopped too soon, blood pressure may rise again. Overdose. Signs of overdose include severe hypotension, very low blood pressure, fainting or dizziness, tachycardia, rapid heartbeat. Management. Stop the infusion, provide IV fluids and medications to restore blood pressure, continuous monitoring of heart function. Stop or avoid taking Fenoldopam if you develop severe allergic reactions, rash, difficulty breathing, you have uncontrolled heart problems, there are signs of severe hypotension. Side effects. Common side effects: headache, dizziness, flushing, warmth, redness, nausea, increased heart rate, tachycardia. Serious side effects. Seek medical attention immediately. Severe hypotension, low blood pressure, reflex, tachycardia, rapid heartbeat, chest pain or shortness of breath, severe dizziness or fainting, worsening kidney function, rare but possible. Drug interactions, other drugs that may affect Fenoldopam. Increased risk of low blood pressure with other antihypertensive drugs, beta blockers, ACE inhibitors, calcium channel blockers, diuretics, furosemide, hydrochlorothiazide, may increase risk of hypokalemia, heart rate effects. Beta blockers, e.g. metoprolol, atenolol, may increase risk of bradycardia, slow heart rate, or hypotension. Alpha blockers, e.g. prazosin, doxazosin, can cause excessive blood pressure drop. Electrolyte balance effects. Corticosteroids, e.g. prednisone, may worsen low potassium levels. Potassium-wasting diuretics, e.g. furosemide, may increase risk of hypokalemia. Avoid combining with drugs that increase intraocular pressure, certain decongestants, steroids, dopamine agonists like levodopa, may enhance vasodilation effects. Final notes: Fenoldopam is a fast-acting, short-term IV medication used in hospitals for severe hypertension. It requires continuous blood pressure and heart rate monitoring to prevent complications like hypotension and tachycardia. Not suitable for long-term blood pressure management.